Okay. Good afternoon, all of you. For the next few minutes or hours, uh, we are going to change the game. Not by adding another tool to your already crowded toolbox, but by giving you a new blueprint for how to use every single tool you already have. This is about the fundamental shift, and from the beginning, from the from being a collector of information to a connector of a principle. So, welcome to Mastery Mindset. Mastery isn't about having a more tools; it's about the building a better blueprint. I am Jaimin Bhatt. I am a physiotherapist working with an ISRO, and I have more interest in human movement science. So, what is about the forging the future of sustainable performance? Look around the fitness industry. It is a it is very I would say that they have a very good mindset. We have bodybuilders, powerlifters, physical therapists, and yoga instructors, all speaking different languages. Our mission is to build a common tongue, a community of a practitioner, united not by the specific method, but by a shared goal to enhance not just the performance, but the lifespan of the people we serve. We are building a league of extraordinary professionals. We are not just fixing the broken athlete, we are just building the anti fragile humans. So, here we are talking about a simplest way how we can uh, improve the athlete's performance, as well as uh, each and every athlete is a different human being. So how we have to implement the proper exercise prescription, that we have to understand. The problem is not a ignorance, it's a overwhelm. You know the feeling, you learn a new technique on every day. Sometimes you learn some techniques on Saturday and Sunday, but on Monday you have a patient, it doesn't work for you. So you panic and jump to the another system and create a confusing, fragmented experience for your patient. This constant jumping, you are collecting the piece of together. Information overload, coaches who know everything, but sometimes the results are paralyzed. From technician to strategies regarding the solution. The solution is to stop seeking the next big things and start mastering the big picture. A technician follows a recipe, and the strategist understand the ingredients and can create a new dish with according to that requirement. It is a commitment to lifelong learning and nuanced application. Focus on principles over the protocols and reasoning over the recipes. Mastery is about understanding the why so deeply that you can invent the how on the spot. You should give more focus on the principles over the protocol and reasoning over the recipes. It is the just difference between being a GPS that only knows one route and being a master navigator who can chart a course through any terrain. So stop trying to be a better GPS, become a master navigator. So that's why we need to understand how we have to navigate all our exercise prescription. And the goal is to become a better problem solver, but not a better exercise prescriptioner. The patient's story is your blueprint. We have to connect the dots. A client or a patient tells you that they have scared to deadlift. The technician hears a problem to be fixed. The strategy is here the most important data point of this session, that fear is a story. But it is not a story of a past injury, it's a bad coach. a feeling of vulnerability. Your first job is to be detective, not to drill us, not to drill to find all his problems. When your program based on their story, what they have told you, you are not just prescribing the exercise, you are just co-writing a new empowering ending to it. So whenever you have a patient with fear, isn't a barrier to your program, it is the blueprint for it. Now, what about the turning movement into the data? When we are talking about the movement convert into the data, which is related to what we are looking for our patients. Sometimes we are missing the 99% of the data. The truth is, first repetition of the warm up is an assessment, and the last repetition of the final set, when when they when they're tired and their form is fraying, and that is the most important assessment that we need that we need to do. Strategies on the other side, or you are with the nervous system, and so stop counting his shoulder joint, how he behaves during the breathing exercise, how he behaves while performing the deadlift. If you are only assessing on the day one, you are not only seeing the cover of the book. It is all about to understand how the athlete is moving from point A to point B. There is a critical difference between landmarks and the timing. The calendar is a terrible coach for us. 2 weeks of mobility work is a guess, it's a hoping. Instead, we use landmarks. A landmark is an objective, visible standard of quality that I usually use in my foundation of functional movement pattern. We will move from goblet squat to the front squat when you can demonstrate the 3 sets of 10 with a neutral spine and control eccentric without pain. This is not a timeline. It's a contract for the quality part. And it aligns your expertise with their live experience, what they are performing. So if you want to achieve the proper movement behavior to your patients, don't let the calendar to dictate the process. Let the quality write your schedule. What you are performing with your patient, that must be incorporate. Body finds the least resistance pathway to move. Here is the most common mistake I see is the fear of loading. So when you have when you have an athlete in front of you with the ACL injury or any lower limb injury, on the other side, if you are talking about the shoulder dislocation, that is also a different task. For the lower extremity injury, and they come to our clinic after the operative procedure, they have a fear of loading pattern, the kinesiophobia, or catastrophizing for their movement. So In that scenario, we need to educate them and understand them how they can load the joint and improve their task. The patient shows up with the pain sometimes, and the well-intentional response is from the patient side is raised eyes, and they sometimes tell us take it easy. This is a slippery slope for us. We are teaching their brain and body that the solution is a problem, and that problem should be avoidance. Sometimes, by giving all these things, by telling all these statement to our patient, we create a more weaker and fearful system. So when they return to their life, they have a tickling time bomb in their mind that we haven't solved during our rehabilitation part, because on every time we just give them a exercise regarding a strengthening and simply go back to their routine activity. We have given them a few of proprioceptive exercise also, but we haven't solved their problem. We have just postponed the next level of injury. So for by protecting from the load today, you are making them vulnerable to it for the tomorrow. Regarding the injury part, now what about the science of loading? Let's be clear. Load is not the enemy. Inappropriate load is enemy. Load is information, and it is the signal that tells connective tissue to remodel, bone to density, and the nervous system to build the confidence. Think of a callus. It doesn't form by avoiding the friction. It forms when our job isn't to remove the load causing the blister. Loading every behind it. This is the art. It is about the minimum dose, is the therapeutic dose. Light. It feels like you are not doing enough, but for a sensitize the system. And it is not exact right amount of new information that we are imposing to our brain, but it is the our routine information that we are just rewiring to the athlete's brain. It is the way where they can succeed with the perfect form and walk away for more confident, but not the broken. Our goal is to see how much they can lift, but how little they need to get better. That is the important part. It- every time it is not about that they lift too much and they perform well. It is about for the synchronization and the smoothness of a movement. Now let's talk about one case. Let's meet Mr. X. He is a runner with the chronic knee pain. Where our old model is avoiding loading, raised, maybe some clamshells, but our model is first, I listen to the patient. So, what Mr. X is saying, he is saying that squat is terrified for me. So, my first intervention isn't an exercise, it is the education. I explain how the hip is the CEO of the knee joint. And then I find the sweet spot, not the squat, but an isometric hip bridge. From that, I understand that in which plane he has a missing link. I use it as an assessment. Sometimes I during the exercise part, I look for the glutes also during the bridging exercise. And that hip bridge that use as an assessment. And that becomes my landmark. And the result that just give a exercise that he control and that we turn fear into the fuel. So we didn't change his exercise, but we changed the relationship with the exercise towards the body. So let's tie the system together, connecting the dots. Mr. X case wasn't one system, it was a three. We use pain science and education to calm the nervous system. We use the physical therapy approach to activate a sleepy glutes. We use a strength and conditioning principle of a progressive overload by adding the whole time. We spoke a three different profession languages fluently to solve the human problem. If he speaks Spanish, he speaks English, he speaks Hindi. If he speaks any language from the India, we are trying to understand and we connect the dots and make them understand what he has to perform and how he behaves during their task. Many of times you don't need a certificate, you need a translator mindset to connect the knowledge what you own already. So stop looking at the one answer, start combining all the right piece together and make a beautiful picture. Now let's talk about some mastery of the feedback loop. This is how mastery grows. It is the cycle. Learn a new cues. Try it with your next three patient. Did it work? Great. Why it works? If it's fail, even better, you have to give them. That failure is the data for us. You have to adjust, you need to refine, and you have to try again. This clinical practice. The joint mobility and the motor control has been given by the physiotherapist. The progressive overload and periodization that has been given with the help of a strength and conditioning coach. And for the pain science, we have to educate with the graded exposure of an exercise. And this loop is the engine of a perceptual growth. We should use the controlled drilling as a warm up, use the strength as a movement, and the and the main exercise doses appropriately that should be based on the on the pain science principle. The continuous cycle of a improvement. We have to learn, we have to implement. Again, you should assess the exercise as a test. Then you adjust all the dosage. Once you adjust the dosage, you just repeat. And this is whole loop of channel that helps our athlete for the better improvement. And for that, what are the key assessment? In my movement uh, table, I use a single leg stance, overhead squat, but this assessment doesn't need to be complicated. It needs to be consistent. The overhead squat isn't about the ankle mobility, it is about how the body solves the problem of getting deep under the load. The single leg stance isn't about your balance test, it is your stress test for the hip. Then you should watch the strategy. How do they compensate? How do they cheat? The compensation pattern is the cues that tell you exactly what to train. You don't just test the strength, test for the strategy also. How the patient is performing the squat in front of you. And for that, we need to building the anti-fragile athlete. We had to programming the athlete for the longevity. When you adapt this mindset, your entire outlook has changed. You stop programming for the game this weekend and start programming for the next game for the lifetime. And you start asking, will this exercise works? Will this habit supports their exercise regime? Your priority recover not as a passive rest day, but as an active investment in the durability of the athlete's life. You are not just building an athlete for a season, you are building a human for a lifetime. So we are not just coach for the sports, we are architect of their lifespan, because the physiotherapist knows how each and every segment of the body moves, and we know the movement science very deeply. So now how we grow together for fostering the community. You cannot do these things alone. Mastery thrives in a community, not in isolation. Find your people, find your colleagues who will challenge your ideas and celebrate your failures. Your growth is directly proportional to the quality of your professional circles. Share your struggle openly to your biggest failure is the most valuable lesson you can offer with your fellow or with your mentors. And there is a saying, the lone wolf dies, the pack thrives, find your pack. So now let's recap what we have discussed till now. So all these things I leave you with this. Listen to the story of your patient, assess the every repetition, progress by landmarks, not by the dates, and always find the minimum effective dose. This is how you turn knowledge into the transformation. Mastery is the journey from knowing what to do to knowing why to do, and that is for who and when. So, now the most important part, what's the first question that's come to your mind? What's your biggest challenge implement in this? So, let's solve together. So, thank you so much for your time, your energy, and your commitment to being better for the people you serve. This is not the end, it is the first step. Now go and build your destiny towards your patients. The world doesn't need more fitness expert, it needs most mastery minded guide. Go be one and join with my membership plan, and you will know a deep dive into how you can make a better athlete.